Dr. Steve Dungy speaking from the Royal Perth Hospital Emergency Department. I've been asked to give a 5 on Friday on the subject of testicular torsion. Some of you may wonder why. I think I've been asked by Nathan and Chris to talk about this subject because paramedics are in the business of identifying things that represent a risk to life and a risk to limb. But not everybody necessarily appreciates that testicular pain may actually be the result of torsion, which will result in the loss of the testicle if things aren't done really, really rapidly. And it constitutes a proper emergency. So what is testicular torsion? Essentially, when the testicle develops inside the sac of the scrotum, the testicle is supposed to be stuck posteriorly and fixed in place within the scrotum. But there are some people in our community whose testicle is floating free, and as a consequence, under certain circumstances, it can rotate within the scrotum, and the blood vessels that are coming down from the body and entering the top of the testicle, as a consequence of this twisting, they get twisted themselves and compressed. Initially what happens is that the veins, which are thin-walled, will collapse off first, and then later on, with enough twists, the artery will actually also be compressed and the testicle won't get any further blood flow. Our problem is that testicular pain is actually more commonly caused by things like an infection. In young guys, the infection is often the result of something they've picked up through sexual activity, and so chlamydial infection or gonorrhea will produce what's called an epididymoorchitis, an inflammation of the testicle and epididymis. Older guys get the same infection, but it's because their prostate's getting large and they're getting an infection in their bladder which spreads to the testicles. And those infections are about 4 times as common as a testicular torsion. They're not as urgent. They get treated with antibiotics and they tend to get better. But a torsion will eventually result in the death of a testicle. Some people think that if you detort them, that's untwist them, within 6 hours, most of them recover. But the fact is probably 20% of those detorted within 6 hours still go on to die later on. So there's a time window in which people can make a huge difference as to whether a person keeps the testicle or not. Most of these testicular torsions occur in adolescent boys. There's been reports of people up to the age of 90 getting them, but essentially it's boys from 12 to 20 who are most likely to get the torsion. Whereas infections, when you start to get them, tend to occur when people begin sexual activity. Why is this important? It's important because if you pick a young man up who says that he's got sudden onset of testicular pain, it is an emergency. We will not keep a guy like that sitting in our waiting room or our ramp, because if there's a chance that he's got a torsion, we want to get them in really quickly. Sometimes when you bring them in, you can look at it and you can actually see it's a twisted testicle. It's very obvious to the naked eye, and those guys go straight to operating theatre. Other times we look at it, we're not certain, and the question is resolved by either getting a specialist urologist to come and see the case or to get an ultrasound, and then deciding whether or not it's an infection or a torsion. But the bottom line is it is a genuine, bona fide emergency, and we do not want young men with acute onset of testicle pain to sit in a waiting room or to sit on a ramp. I personally have got 2 colleagues who are enormously competent, who've both been in a situation where a young guy sat in a ramp with something that was thought to be renal colic, because sometimes the pain they get is low abdomen and going up to their kidney. In both those occasions, 3 or 4 hours on the ramp didn't do the testicle any good, and it wound up in a bin in an operating theatre because the diagnosis was delayed. It really matters, and the part that paramedics play in identifying these people early is really significant. It's still a rare condition, and most of the time you'll be dealing with something which is an infection rather than a torsion. But young man, sudden onset of testicular pain is something that we really care about, and the take-home message is that you need to make a fuss when you bring those guys in, because we will want to see them quickly and identify whether it's a torsion or not. I don't think there's much more to say about testicles for now, so I'll sign out. Thank you.